Right now, from KTAB News, your local election headquarters, this is Big Country Politics.
Thank you so much for being here for Big Country Politics. I'm Travis Ruiz. All right, this COVID-19 pandemic has left many folks without a job. Locally, Workforce Solutions of West Central Texas says it has seen an increase in unemployment claims, with the month of March seeing its largest increase from around 175 people to now more than 5,000. So, in an attempt to reduce call traffic, the Taylor County Unemployment Office has now set up a new system dedicated to serving those with specific area codes.
The number 3. They're requesting that individuals call in on Monday.
Right now, from KTAB News, your local election headquarters, this is Big Country Politics.
Thank you so much for joining us here for Big Country Politics. I'm Travis Ruiz. This COVID-19 pandemic has left many folks without a job. Locally, Workforce Solutions of West Central Texas says it had seen an increase in unemployment claims. Now, with the month of March seeing its largest increase from around 175 people to now more than 5,000. So, in an attempt to reduce call traffic, the Taylor County Unemployment Office has now set up a new system dedicated to serving those with specific area codes.
So, for example, for our area code that starts with 325, it starts with the number 3. They're requesting that individuals call in on Mondays, Wednesdays, and Fridays from 1 p.m. to 5 p.m.
And Workforce Solutions is also allowing the Unemployment Office to post-date those claims, allowing those who need it to get benefits from the time that they submitted. All right, now to our Eye on Education. Things looked a little differently at the monthly meeting of the Abilene ISD School Board. KTAB's Mercedes Hernandez has more on how administrators are continuing to adapt.
The Abilene ISD School Board went online for its April meeting, where members took action on several COVID-19 related items.
So we're now going to move to item E.
One of the first items up for consideration was allowing the district to apply for a waiver for educator appraisal requirements.
So the system that we use to appraise our administrators, our teachers.
This item was unanimously approved by the members, as the school would not be able to complete the appraisal process as it has in years past because classes have been suspended. Another item approved by board members was the extension of payment to workers like substitute teachers. These employees weren't included in the board's original motion from last month's meeting to pay employees while campuses are closed for coronavirus. However, there are certain criteria for those subs in order to get paid.
They had to work for us for at least 90 school or instructional days, and then any substitutes that had committed to long-term assignments.
Now, members also workshopped several ideas related to adapting school grades and ranks amid the current pandemic. Dr. Dan Dukes, Associate Superintendent of Curriculum and Instruction, shared that in order to meet grading regulations set by the Texas Education Agency, students might have to complete 6 assignments by what would have been the end of the school year. These assignments would likely be graded with a pass or fail, not a numeric grade. Dr. Dukes also shared that the district is considering generating final course grades by taking an average of students' grades from the first 4-6 weeks of the school year. However, these are all just suggestions. The board didn't take action on them Monday night. Administrators, much like everyone else right now, are working in uncharted territory.
It's become a little bit more complicated than we had initially anticipated.
In Abilene, with coverage you can count on, Mercedes Hernandez, KTAB News.
All right, the state and federal government also waiving several regulations to increase access to telemedicine amid the coronavirus outbreak, which could prove especially helpful in rural areas. KTAB's Maggie Glenn outlines the progress that's been made in just a few weeks.
We are doing a lot of Zoom visits, and so that's technology that has been available, but we were not availing ourselves of it because of those regulatory concerns.
Doctors can now use Zoom, which is how this interview was conducted, for regular visits. Before, patients would need to see a physician in person to establish care before being able to use telehealth services. Now, if clinics, especially in rural areas, get overwhelmed,
it is possible for patients in a rural area who need care but don't have access to their usual source of care there to actually establish care with us and get the care they need over the telehealth service through video.
Healthcare providers hope these changes last beyond just the COVID-19 crisis.
Changes that have been made because of the public health emergency have led to a coalescence of opinion that we need to do what needs to be done to make this accessible because it's so important. So that process might have taken years, and instead it's been playing out in a period of weeks.
In the last legislative session, a bill passed to allow providers to get reimbursed by insurance companies for telehealth visits. Representative Forprice says in the upcoming session, lawmakers will be taking a serious look at how they can make telehealth even more accessible.
I don't think there'll be a lot of pushback. In actuality, it's nothing more than simple use of technology to provide health care.
Now, HIPAA is currently providing an exception for the use of Skype, Zoom, and other video interfaces, but for privacy and security reasons, this will only last the duration of the pandemic. And as we go to break, we'd like to share with you a special message from the United Way of Abilene.
Hi Abilene, my name is Justin Crow and I have the privilege of serving as the chairman of the board for the United Way of Abilene. I think everyone would agree that this is a unique and difficult time for our community. Every single family has been impacted in some way by the COVID-19 outbreak, and it has affected everything about our daily lives. Since 1956 through today, it is moments like this that the United Way of Abilene was created. Beginning in 2002, the City of Abilene and the United Way have been partners with 211 West Texas Call for Help. 211 is a wonderful tool to help you navigate during today's trying times. 211texas.org will allow you to use your zip code and find the closest location for important information on food, housing, utility assistance, and other basic needs. I wanted to take a few seconds to give an update about how we are responding to help our neighbors. In only 4 weeks since forming the Abilene United Fund, many direct services have been set into motion to help families in our community meet basic needs. Here are some of the highlights of our United Abilene efforts. Money donated to the Abilene United Fund has allowed the United Way to partner with the Alliance for Women and Children, the Boys and Girls Club, and Abilene ISD to establish the Abilene United Day Camp. Located on 2 Abilene ISD campuses, the day camps have been created to offer free childcare for families who are employed in essential industries throughout the community. Currently, 300 children ages 5 to 12 have a place to go so their parents can continue to bravely serve during the pandemic. In addition, $50,000 was granted to the Food Bank of West Central Texas to keep local food pantries stocked to serve those with grocery needs. The Christian Service Center received $30,000 from Abilene United to help with housing and rental assistance. $1,000 was donated to Abilene United by the Junior League of Abilene to go directly to stocking the pantry at the Adult Protective Services office so that their caseworkers can make sure our most vulnerable have the care they need. We, over here at 240 Cypress Street in downtown Abilene, will continue to press on by focusing on our mission to bring together nonprofits, donors, businesses, volunteers, and the public sector as we tackle together the big issues in our community. If you can, help us meet the needs in our community by donating to our relief efforts. You can text Abilene United to 41444 or visit our website at unitedwayabilene.org. I wish you and your loved ones health, safety, and protection. Stay home if you can, and stay well.